Hi, welcome back. This is Dr. Meret. I wanted to talk about ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. It is a neurodevelopmental condition, and all that means is your brain developmental happens in childhood, and it's very much possible for it not to be diagnosed until teenage years or well into adulthood, but the symptoms do need to be present at least before the age of 12. There are three subtypes. There is the inattentive subtype, and there is the hyperactive or impulsive subtype, and then there's combined presentation. So with inattentive, we see things like distractibility, like it's really, really hard to focus. We have forgetting, so a lot of forgetfulness. So for kids, this can look like forgetting their homework, forgetting their permission slip, forgetting a pencil. For adults, forgetting where you place your wallet, constantly losing your keys or losing your phone. It could also look like trouble with planning, trouble with time management, trouble with organization. And this could be like organization of your external environment or internal organization. With hyperactive or impulsive type, so for kids, a lot of times this shows up as like they can't stay still, like so they're constantly moving around, shaking their legs under the table. It could also look like having a hard time waiting in line, or when somebody's speaking, they're constantly interrupting, and they're not trying to be rude, they just can't help themselves. And with maybe teenagers and adults, this can look a little bit different. So this can show up as like risk-taking behavior. So speeding when you're driving, or excessive alcohol use, excessive drug use. It could also look like trouble with emotional regulation. So your emotions are up here and down here, up and down and up and down. So a lot of times people with ADHD can have a very quick and a very strong emotional reaction to something. And then combined presentation is when we have a combination of the two, the inattentive and also the hyperactivity or impulsivity. And with ADHD, it involves dysregulation of dopamine and also norepinephrine in the prefrontal cortex of the brain. So that is the part of the brain that is oftentimes associated with the things that I mentioned. So attention regulation, emotional regulation, behavioral regulation, planning, time management, prioritization, so all of these things. And so essentially that's what ADHD medication tries to do. And I know different people have different feelings about it, and that's okay. But essentially what it tries to do is makes dopamine more available and norepinephrine more available in that part of the brain, so that it can alleviate some of the challenges that ADHD presents. But that's not the only solution, right? So exercise is huge. And it doesn't have to be a very intense and long and rigorous exercise. So you don't have to be in the gym all the time. So this can look like going out for a walk. It could also be something as simple as standing when you're working. So anything that can keep your body moving. It could be, especially for kids, having a fidget could actually be really helpful. Even chewing sugar-free gum. So anything that gets your body moving, anything that involves movement will be really helpful. Sleep is also huge. I should do a video just about sleep. The impact of sleep deprivation on attention regulation, emotional regulation, impulse control is huge, and is especially so for people with ADHD. And then there's other things that could be helpful. So working with an executive function coach can be helpful for developing some of those skills around time management and planning and prioritization and things like that. And just kind of learning how your brain works, especially for people with ADHD or people with kids who have ADHD. So learning how their brain works and creating an environment and structure that facilitates their progress and their success. So we can talk more about tips and strategies maybe in the next video, but I do want to just finish by saying this. So a lot of times, especially within the Abisha community, kids that we label as like Rabbash or like balagi or rabbash, a lot of times they may just have ADHD, right? So it's not necessarily them wanting to be malicious or wanting to be unruly. It can just be an underlying challenge with ADHD. Alrighty, see you next time. Bye.